Uh, so this is the anatomy station, lower limb. So I'm going to put a timer for you. So usually 1 minute for candidate instruction and 9 minutes for your performance. So I'm going to put 9 minutes timer. So within 9 minutes, you have to answer all the question. And I may ask some related extra question. Okay. So I'm going to share my screen and start timer. Is that okay?
Yes, okay.
Okay. Can you able to see my screen?
Yes, I am.
Thank you. Can you identify number 5, number 6, number 7 area and the muscle attachment of that area?
Okay, so this bone is iliac bone, and these are the muscle attachment for gluteal muscles. I think 7 is gluteus minimus. 6 is medius, and 5 is maximus.
Okay, 5 is maximus. Okay, can you tell me the insertion of gluteus maximus?
It inserts on iliotibial tract, and also attaches to gluteal tuberosity of the femur.
Can you tell me its nerve supply?
It is supplied by inferior gluteal nerve.
Can you tell me its roots value?
It's L5 to S3.
L5 to S3. Okay.
Yeah.
Oh, okay.
Or
So
maybe L4 to S3, not sure.
okay, we'll discuss it later. So can you tell me what the gluteus medius muscle insert?
Where does gluteus? It inserts on the greater trochanter of femur.
Action of gluteus medius.
Action. Okay, so it helps in abduction of the hip.
Okay. So now, what are the clinical signs for related to gluteus medius muscle?
So, and patient with had the Trendelenburg gait, and Trendelenburg sign would be positive.
Okay. So what does the iliotibial tract attach?
It attaches. It is from iliac tubercle to it inserts on laterally on tibia, on later condyle of tibia.
Okay. So can you identify number 1 from this picture?
It's is number 1 labeled to an artery or a muscle?
Okay, it's a muscle actually.
Okay, so it's a gluteus maximus muscle.
Number 2.
Gluteus medius.
Number 3.
Minimus, gluteus minimus.
Number 15.
It's a sciatic nerve.
Okay. Can you please tell me the surface marking of sciatic nerve?
So sciatic nerve, it is basically a curved line between a point between and posterior superior iliac spine and ischial tuberosity. A point midway between these 2 points, and a point between greater trochanter of femur to ischial tuberosity, a point between these 2 points, and so there's a curved line joining these 2 points.
Okay. Can you tell me its roots below?
Sciatic nerve is L4 to S3.
Okay. So can you please tell me the boundaries of triangle as well as content?
Okay, so femoral triangle, so boundaries are uh, um, superiorly inguinal ligament, medially adductor longus muscle, and laterally sartorius. And floor is also bipectineus muscle. Its contents from medial to lateral are nerve, vein, artery, nerve, and also most medial would be the lymph nodes, inguinal lymph nodes
Which
of
vein, which
femoral.
artery, which nerves?
So most medial is femoral vein, and then following lateral to vein is femoral artery, and then lateral to artery is femoral nerve.
What is femoral sheath?
Um, Femoral sheath is a facial extension, and it uh, um, I can't recall. Yeah.
Okay, okay. So the next question is, what is femoral canal?
Femoral canal. Uh, I can't recall.
Okay, no
Don't.
problem. Can you identify this structure? 7, 8, and 9?
7, 8, and 9. Okay, 9 is femoral vein.
Hmm.
7 is femoral artery,
Hmm.
and 8 is femoral nerve.
Okay. So can you please tell me the boundary of adductor canal?
Adductor canal boundaries. Okay, so laterally is vastus medialis.
Hmm.
Anteriorly it's I think sartorius.
Hmm.
Um, mm, uh, mm, what else? Mm, I think superiorly it's yeah, laterally
Can you tell me the
medial.
contents of it?
Yeah, it passes femoral artery and vein, and uh
Anything else?
saphenous nerve
Hmm.
and saphenous vein.
Anything else?
Um, I can't recall. Yeah.
Okay. Okay. Can you tell me the structure number 15, number
Mm.
11, number 12?
Okay, so 11 is semimembranous muscle, 12 is semitendinosus muscle,
Hmm.
and which other structure you said?
Number 15.
15 is it looks like a nerve. Yeah, it's 15 is sciatic. It's a tibial nerve. Yes.
Okay. Can you please tell me the boundaries of popliteal fossa?
Okay, so superiorly, medially, it's semimembranous muscle and semitendinosus.
Hmm.
Superiorly, laterally, it's biceps femoris tendon.
Hmm.
Inferiorly, medially, it's medial head of gastrocnemius muscle, and
Yes, I'm
inferiorly lateral.
finished, but I'm going to ask a few more questions. Is that okay?
Yeah.
Okay.
Okay, so inferiorly, laterally is gastrocnemius, lateral head of gastrocnemius muscle.
Mhm. So can you please tell me its contents?
It passes femoral, popliteal artery, popliteal vein, tibial nerve, common peroneal nerve, and lateral cutaneous nerve of the thigh. No, not the thigh, of the leg. I think cutaneous and saphenous nerve also.
Okay. So can you identify number 6 from here?
It's a deltoid ligament.
Okay. Attachment of deltoid ligament.
Superiorly, it's tibia and medial malleolus, and inferiorly, it's talus and
Okay, can you identify number 1?
it's a tibiotalar ligament.
Number 3?
Okay, I'm confused if it's a medial side or lateral side.
Check this. Okay, I'm giving you clues. It's a lateral side.
Okay. Okay, so 3 is calcaneofibular ligament.
3 is calcaneofibular ligament. Okay. 1?
And 1 would be then talofibular ligament.
Okay. Number 19?
This would be posterior talofibular ligament. Talofibular, I think.
Okay, accepted. So can you identify number 17?
Yes, it's tibialis anterior.
Yeah. Number 7.
Number 7 is extensor hallucis longus.
This structure.
This is dorsalis pedis artery.
Okay. Can you please tell me the landmark of it?
A landmark of what, sorry?
Arteria dorsalis pedis.
You mean surface anatomy, like where you can palpate the pulse?
Okay.
Hello.
Tell me the arches, name of the arches formed by foot bone.
So there's a medial arch, there's a lateral arch, and there is transverse arch.
Okay. So for medial longitudinal arch, tell me the name of the bones.
It's a medial trait or medial 3 cuneiform bones. And there is talus and calcaneum and navicular bone.
Okay. Let's check. Okay. Anything else?
And metatarsal and first tarsal bone. No, first metatarsal bone, sorry.
Only first metatarsal. Okay.
First, I think 3, medial 3. Okay, and the lateral longitudinal arch, it would be cuboid, lateral to metatarsal, and calcaneus, sorry.
Okay, thank you so much for your participation for lower limb OSCE. So, arches. So, can you see the curvature? So, medial, lateral, this part. So, if you are going to tell the medial, so first come is talus, calcaneus, navicular. The first three bones, talus, calcaneus, navicular. These three, and then you can tell these three bones. What are the three bones? These three.
Okay.
Three metatarsal, medial, and three cuneiform. So these are the for bones that are forming medial longitudinal arcs. So you have to remember medial longitudinal arcs, lateral longitudinal arcs, transverse arcs, and their support, their function. That's the important. Anything they may ask from these arcs. So arcs is really important for MRCS OSCE exam anatomy part. So from very beginning, if we like to go from here, so this is the number 8 is femoral nerve, this femoral artery, femoral vein. You told it better. So femoral sheath, actually this covers this femoral artery and vein. Okay, so it covers this fascia transversalis and fascia iliaca is formed by, and the femoral canal is the medial side of femoral vein. This allows the space when increase interabdominal pressure or venous return. It helps to increase the diameter of this femoral vein. It allows. There's one lymph node of closet here. And you have to understand all these boundaries and content for this. And the canal for adductor canal. So adductor canal, you mentioned its boundary, but the boundary issue lateral, posterior, and roof, no medial things. Okay, so laterally here, vastus medialis muscle, so where it should be down some little bit. I don't have any figure related to this at this moment. Okay, here. So it should be laterally vastus medialis here, and roof is formed by sartorius. Actually, roof is formed by sartorius muscle, and posteriorly adductor longus and adductor magnus. So the content is okay, femoral vein and femoral artery. So if it's better if you can mention the superficial femoral vein and superficial femoral artery, and the rest of the two important structure are saphenous nerve as well as nerve to vastus medialis. And if the asks another question, so what structure is coming out from Hunter canal? So three structure coming out, four structure get entry, and three structure coming out. So what are the three structures? Saphenous nerve, femoral artery, femoral vein that continues as a popliteal artery and popliteal vein. So okay, this is the popliteal fossa. And here you should understand the deltoid ligament and lateral collateral ligament. So don't forget this. So it's a common question for MRCS OSCE, and nowadays this is quite common to they may ask lateral collateral ligament and deltoid ligament. So deltoid ligament is four parts actually: anterior tibiopatellar, posterior tibionavicular, tibiocalcaneal, posterior tibiopatellar, anterior tibiopatellar, posterior tibiopatellar. So it's come from tibia. The first thing is it comes from tibia, and then attach this area. And lateral collateral ligament, it's come from fibula, but the name is from talus is talofibular ligament. So the number 1 should be talofibular ligament. Number 3 is come from calcaneus, so calcaneofibular ligament. And if you go for this 19, so it's posterior talofibular ligament. You told that. So you should understand deltoid ligament, lateral collateral ligament, and their attachment. It's really important to understand the attachment of deltoid ligament. It's a quite common question. So you did better this. Can you tell me the number 11 and 12 and their nerve supply?
So 11 is peroneus tertius and 12 is peroneus longus. No, sorry, 11 is peroneus brevis and 12 is peroneus longus.
So what is the nerve supply?
So they are supplied by superficial peroneal nerve.
Mhm. Okay, number 7, number 8.
Mm, um, I think
The same thing, peroneus longus and
yeah,
brevis. Just check the figure. That's it. The peroneus longus and brevis. Okay, the
okay.
lateral sides. Apart from that, this area, okay. So this is gluteus maximus, medius, minimus, sciatic nerve, piriformis. So understanding is important there. Nerve supply, action, root bellow, that's important. So if you mistake regarding root bellow, so root bellow is important for gluteus maximus and gluteus medius. So for gluteus maximus, root bellow is L5, S1, and S2 only. L5, S1, and S2 for gluteus maximus. Okay. So rest of the thing is okay. I think your preparation is up to date, but you need so one tips for you. When you stuck any question at any point, please don't stuck at that point. Just tell that, I'm sorry, I can't answer this question at this moment. I'd like to proceed further, and then I'd like to come back this question again. So if you think and spend 1 minute to sort out the gluteus maximus, root bellow, 1 minute. I mean, they may ask 20 question, 16 to 20 question within 9 minutes, and you have to answer all the question. And if you lose mark more than 4, I mean, that station, you have to think that there's a station may not be good station for you. So my recommendation is when you stuck any question, go faster. Like to answer next question. I'd like to come back it again. Okay, you understand my point? So there's the thing you need to do. Apart from that, rest of the thing is okay, but you need to practice repeatedly and identify the structure and spontaneous answer. It's a, again, I say it's a time game. Within 9 minutes, you have to answer a lot. At least you have to collect some marks from anatomy 3 station. It's a straightforward station, and you'll collect all the marks from anatomy station. Okay, you understand?
Right. Thank you.
Thank you so much for your participation.